So now I will go to the last element that, again, I emphasize this is important now, is about the functional depth. Most patients, even transgender patients whose sexual preference is lesbian, would like to achieve depth even more than the cis women normally have. This is true with my experience. So, the creation of the vaginal tunnel should be as deep as possible, and their average depth should be between 6 to 7 inches. The creation of the vaginal depth should be not limited with the length of the amount of penis skin. So, the non-penile version can be applied to almost cases and commonly achieve good and to excellent depth for newly created vaginal tunnel. The option of the colon vaginoplasty, in my opinion, should not be recommended due to the condition of the short penis. Some patients expect self-lubricate of the vagina. This is okay. This is true for some patients. But I would recommend that we're going to discuss thoroughly about the pros and cons of the colon vaginoplasty. We talk about the primary colon vaginoplasty. Most patients do not want to lose the original depth or have difficulty for vaginal sexual intercourse or even routine dilation. So that means we focus on the vaginal dilation routine program that we talk in detail, emphasize during consultation, that patients understand clearly that they take full responsibility to follow the program. Most patients expect to experience pleasure sensation during vaginal stimulation or penile penetration, or even ability to have the vaginal orgasm. In my opinion, the skin graft, which is considerable the thin tissue make for the vaginal lining that we use routinely for the non-penile inversion technique, should be the ideal lining, rather than the thick tissue like penile flap inversion or even colon graft. Most patients concerns about the possibility of the hair growth inside the vagina. So this is common questions that patients ask during consultation. So that means all hairs follicle must be totally removed from the skin graft being used for vaginal lining according to non-penile inversion. Few patients would seek a cosmetic SIS. This is patient preference. Cosmetic SIS means the vaginal without the functional depth. So a shallow vaginal opening, I mean maybe 1.5 to 2 inches, is needed to maintain the natural look, to make the illusion of the vaginal canal. The difference between sex and gender is what you see. Gender is what you feel. Harmony between the two is essential for human happiness. Thank you.